This is One on One. We are proud to have Michael Pasterchick, Chief of Detectives, Monmouth County Prosecutor's Office. Good to see you, Michael.
Good to be here, Steve. Thank you for having me.
We're doing this series in cooperation with our friends at the Partnership for a Drug-Free New Jersey. You'll be seeing a website up throughout this program, the American Medicine Chest Challenge. We have an epidemic dealing with heroin.
Right? We absolutely do.
What's going on?
Well, we've had a heroin problem in this state for a number of years now, but it's even more out of control, Steve. It's a #1 public health hazard that we're worried about in the law enforcement segment. Last year alone in Monmouth County, we had 68 overdose deaths from heroin, 68 lives lost to this drug that's enslaving our young people and our citizens.
What has been causing it to get worse in the last few years?
Well, it's always been there, but two things that are alarming to me. This is a suburban problem. This drug is out in all of our communities, and make no mistake about it. It's in our bedroom communities. It's in everybody's backyard. And what's really driving this is the high purities in New Jersey.
High purities?
The high purities of the heroin. We have some of the highest purities of heroin in the nation. They do special testing on the heroin, and we have double the national average for purities of heroin on the streets of New Jersey. In New Jersey, we can buy heroin in $6, $7, $8, $9 bags at 95% pure. You can't buy any better heroin in the world, and we can buy it in small little dime bags, sometimes less than a 6-pack of beer, and we can buy, our young people can buy it on the streets of New Jersey.
Why is it so cheap, and why is it so available?
The reason it's cheap and available is, #1, we're between two major markets in Monmouth County, between Philadelphia and Newark, New Jersey. They have direct importation of the heroin.
Newark is a major market? I thought you were going to say New York.
Newark is the highest purity. Newark has higher purities than New York does right now.
Newark?
Newark, New Jersey, yes. And Philadelphia has the highest purities in the country. And we in Monmouth County are situated between those two major markets, where heroin comes in from Colombia. It's all the heroin that comes into the East Coast here is from Colombia. We have direct importation, and then the markets drive it in New Jersey, and we have these very extremely high purities. In New Jersey, unfortunately, it's estimated that 10% of the heroin addicts in the United States live in New Jersey.
10%?
That's correct.
One of 50 states?
That's correct.
You're involved in a very aggressive public awareness campaign, which is why you're with us today. Talk about it.
Well, we believe in being a DEA agent for 27 years. I've realized that we're not going to arrest our way out of this, Steve.
Why not? Why can't we just arrest everybody involved in the drug trade and in heroin? Can't do that?
Because there's always somebody selling it out there. We need to attack the demand side, and we need to do it through our prevention efforts and the media awareness, like you're doing here today, like we're doing out in the schools. Prosecutor Grimichione has gone out to all the public schools talking to the parents.
That's Prosecutor down in your county?
That's correct, Chris Grimichione. And we've gone out to all the schools and trying to spread the message, because we have to get to these young people.
What's the message to a 15-year-old?
Well, what we've chosen to do first, Steve, is we've chosen to talk to the parents first. And here's the reason why. We've gone out to all the parents groups at night, and we've had some big audiences, 400 or 500 people, because there was a study done years ago, and in that study they asked high school students that were graduating high school that were drug-free. And the #1 reason they were drug-free is they said they didn't want to disappoint their parents.
The #1 reason?
That's the #1 reason. And that's a real strong message for all of us as parents, to talk to our children, make sure they would feel they're disappointed if they go on a life of drug abuse. So that's why we've decided to go to the schools first. We've decided to use the media as PSAs and public service announcements to try and get the word out, because we can't just do it alone and through our enforcement efforts. And we've had some tremendous enforcement efforts in Monmouth County, but we also needed to be coupled with the demand reduction by talking to people and trying to reduce the demand. Because quite frankly, once the young people start out using a bag of heroin, the statistics are not very good that they're ever going to go on and lead a productive life.
So the key is to try to prevent a young person from ever using in the first place.
Absolutely. And it starts out usually with prescription drug abuse, and then goes from there and goes into heroin abuse.
Talk about that piece, because more and more young people and others are ODing from prescription drugs.
Absolutely. And between the years 2006 and 2011, there were 16,000 overdose deaths. But the Attorney General just came out, the United States just came out in February. There were 16,000 overdose deaths from opiate pills in the United States those 4 years, from 2006 to 2011. Also during that same period of time, there was 3,000 heroin overdose deaths. we're a society of overprescribing. The young people start out trying to use these pills, or maybe even get hooked on them from an injury or whatever, and then they can't get them any longer. And when they start abusing them, so they go to heroin, which basically enslaves them usually for the rest of their life, if not killing them.
We have that site. Keep it up there, folks. The AmericanMedicineChest.com website. We're doing this program in cooperation with our partners at the Partnership for a Drug-Free New Jersey. And our friends at Activists and some other places have been committed to this effort. And the reason is, listen, those of us in the media have to be part of this effort because we have this platform, and that's why we're doing it. Because if you cannot bring this information to folks and they cannot keep getting it, you have to, why is it important to reinforce? I keep thinking about reinforcement. Someone says, I've seen that PSA before. And I'm thinking, why do we keep running the same PSAs as part of our series? If you watch in between our programs, there are PSAs. One of the reasons we keep running the PSA, why do we keep running the PSA?
It's too valuable, Steve. We have to save these lives.
Why do you keep repeating it, though? Tell folks why you repeat it.
Because there's a big yawn out there. People don't realize that this is going on, and the numbers and the people that are dying every day from heroin abuse. And we have to make a public awareness, because that's the only way we're going to get to save lives.
And repetition matters. Talk to me about Narcan. What is Narcan?
Narcan is it's a nasal spray that can reverse the effects of heroin abuse or overdose. When a person overdoses on heroin, you can spray Narcan into their nose. We've deployed it about 2 weeks ago in Monmouth County. Police officers now in Monmouth County, throughout Monmouth County, have Narcan, nasal Narcan. They spray it if they come upon a scene, which the officers are usually the first ones to get to a scene, not the usually emergency medical people. If the person has overdosed by heroin, and there's steps they can determine whether they've overdosed by heroin, they spray the Narcan into their nose, and it goes to the receptors where the opiates or the heroin have affected, and basically have stopped the breathing. And miraculously, people come back to life. People will just sit up and all of a sudden come right back to life immediately once the Narcan is sprayed into their nostrils.
How accessible is Narcan today?
We have it in almost all the police departments in Monmouth County. Ocean County has it. They've had it before us. Also, the governor last week just announced they're rolling it out throughout the rest of the state. It's out there saving lives. Just in 2 weeks, we've had 6 reversals in Monmouth County where we saved 6 lives that would have been lost to heroin or opiate overdoses in the last 2 weeks. We've saved 6 lives.
You know, you talk about all the work that you're doing down in your county, right?
Yes.
And there are 21 counties in New Jersey. You've got several states that we're seen in. People have to be asking themselves as they watch this program right now, well, how do I know what the government officials, what the law enforcement professionals are doing in our community as it relates to this heroin problem? Is it only going on in suburban New Jersey down at the Jersey Shore? Is it not something we need to be worried about? So my question to you is, what can the average citizen do to become more engaged in this effort?
Well, like I said earlier, too, I think the average citizen and the parents need to talk to their children. They need to talk to them about the perils of drug abuse and where it's leading. That's our biggest thing that we can attack this from, is starting with the young people when they're young, and talking to them about the problems with heroin abuse or even drug abuse in itself and where it leads to. Every parent in their home should be talking to their young people about the perils of drug abuse. And that's where it starts, quite frankly, Steve. And what we're doing throughout the state is, Narcan is being deployed throughout the state, but we're stepping up all our enforcement efforts, and as you can see, all of our media efforts, because we want the awareness out there. We need to get the awareness out about the perils of this drug that's enslaving and killing our young people.
Finally, a few seconds left. Is this personal to you?
It is. I was with DEA for 27 years, and you don't want to see these young people enslaved or worse yet, lose their life over a substance like heroin.
And when you're out there in these seminars, you see these young people, you know what they're facing.
Sure, and the odds are not good that they're ever going to beat it. Once they start, we got to get to them before they start, because the odds are not good that they're going to beat the addiction.
Listen, we appreciate everything you do. Thank you very much.
Thank you for having us.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by activists in cooperation with the American Medicine Chest Challenge, MagnaCare, New Jersey Sharing Network, the law firm of Gibbons PC, Community Education Centers, PSE&G, Sun National Bank. Promotional support provided by The Record, North Jersey's trusted source, and NorthJersey.com, and by New Jersey Monthly, the magazine of the Garden State, available at newsstands. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.